Thanks, you touched on it with the vaccine age lowering. Many parents still have questions about their children getting the shot. So we do want to bring in now with some advice for parents, pediatrician Dr. Candice Jones. Good morning, Dr. Jones. It is always good to see you. How are you?
Good morning. I'm great. How are you?
I'm doing really good, and I'm doing good because I'm one of those parents who I don't mind if my adolescent son, gets the vaccine. He is 17 years old, and I know a lot of parents, though, have an awful lot of questions in terms of the safety, right? Is it safe for adolescents ages 12 and up to be vaccinated?
So 16 and up is what is approved for right now. The vaccine has been proven and shown to be safe and effective. So yes, I do encourage parents to get their children 16 and up vaccinated as well as themselves. Now, the new information we have from the Pfizer vaccine, preliminary data, they have studied 12 to 15 range and shown also that that age group, the vaccine is safe and effective, but that has not been approved yet. And we're hoping that will happen sometime this fall before school starts, so my son can also get vaccinated in that age range.
I think a lot of parents do want to kind of get back to a sense of normalcy, right, in terms of getting their kids back into the classroom come fall. And I think you can maybe ease some fears, right, if you know your child is vaccinated, at least for some parents out there. How can parents ease their children's fears about getting the vaccine?
You know, parents are the teachers and the models. If they get vaccinated, their children see they did well, and they see the importance of this vaccine in ending this pandemic, they are not going to have a problem with getting this vaccine. Children are used to getting vaccines, right? Even our teens. So I think they'll do better than we think they will.
I think you're probably right about that. Yeah, you're right. They're used to getting vaccinated for sure. How will vaccinating adolescents help schools resume more normal operations? Because you talk about teachers and students and all of these folks, right, who are going to be in kind of a small area during the course of several hours.
It's very important to having that level of safety in school for teachers, all staff, and now students to be vaccinated. Children make up about 13% of COVID-19 cases in the U.S. Some children have died and many have been hospitalized, and you don't know who will or who won't. So they are important to ending this pandemic and making schools safe. Once my child gets the vaccine, he's going back to school.
And you put your head close to the camera. He is going back. There is no question about it. And you know, because I think a lot of parents are anxious to get their kids back to a sense of normalcy, to get them acclimated with their friends that they probably haven't seen or been close to in a very long time. I do want to end with this. When you talk about the younger kids, right, because I also have a younger child, he's the one I'm more concerned about than my teenager getting vaccinated. Do we have any idea in terms of when the testing will be done on those kids and in terms of when they may be able to be vaccinated as well?
We're not quite sure of dates and time, dates, of course, but there are studies, age de-escalation studies ongoing with all of these vaccine makers. Right now, Pfizer is trying to get the 12 to 15 approved, and then they and Moderna and also Johnson & Johnson, they're all going down by age groups as they get the prior one approved and into people's arms. So that is ongoing. What I've been hearing is for younger age ranges, it goes by groupings, and hopefully all children can start to get these vaccines by next year. The younger children.
Sounds good. Dr. Candice Jones, I'll see you at school, okay?
Yes.
Okay. Take care. Have a great weekend. I know we're looking forward to that. Amy.